everyone, my name is Paris Barnett and I work at Stanford Healthcare Emergency Department. First I want to start off by saying Happy Nurses Week to everyone, every nurse out there who's worked so hard this past year for COVID, and basically every day they take care of their patients, take care of themselves, their families, and pretty much everyone around them. So I'd like to say Happy Nurses Week to everyone. So I'd like to show you guys how to make a simple essential oil roller for anxiety, stress, and sleep, kind of like a combination of them. I'm not going to use a lot of ingredients, so it'll be easy and simple. So the first thing you're going to need is fractionated coconut oil. I usually like to get mine organic. I get them in big bottles and I refill a small bottle, which makes it easier for me to pour into the smaller rollers. Next you're going to need is actual essential oils. You can do them as easy as using one that has a blend that you like. This one is called Stress Away. It's by Young Living, but I like it. So you can use this and coconut oil and be done. Or you can get, lavender and chamomile and a couple other ingredients and mix them together yourself. I also have a bunch of different variety of brands here. I like all of them. I have my own particular favorites, but it really doesn't matter. Whatever one you like, just make sure that they use good ingredients and that they have a way of verifying where they're getting their product from, how they're making it, how it's distilled. Okay, so next is your rollers. Sometimes they come pre-assembled as this, and sometimes they're not. If they come pre-assembled, they will come with a little device, and you can pop the top off like that, and that's how you're going to fill it. We're gonna put this little tiny funnel so that we can fill up our coconut oil, because that's the first thing we're gonna do. So you're gonna fill up your coconut oil. What we want is about 90% coconut oil and 10% of your essential oils. Okay, and then we are going to use these tiny little pipettes. There's plastic and there's also glass ones. I like the glass ones better. So what I'm gonna do is use some lavender, and I usually like, some of the lavenders already have the top, a lot of them have the tops already on them for droppers, so you can just use that. 1, 2, 3, 4, 5, 6, 7, 8. I really like a lot of lavender, so I'm gonna use 8. You can use as many as you like. Some people are allergic. You can just not use it at all. Frankincense, I really like frankincense as well. These are really good for stress and anxiety and calming the mind. So I'm gonna use 1, 2, 3 of that. Accidentally got 4. Next, what we have is I'm going to use my chamomile. So chamomile is another one of those flowers that's very calming and good for sleep and stress and that kind of stuff. So see, this one does not have a top on it, so we're gonna use our little pipette. And I'm going to do 1, 2, 3, 4, 5. And then make sure you have a container so that you can put your pipette in. Otherwise, it's gonna be quite messy. And our last one here is, margarine. Margarine is another one that's good for stress, anxiety. And this one has its own little dropper. We're also gonna put 3 of this. 1, 2, 3. And sometimes I just get really excited and go, I really like my lavender, so I'm just gonna add a few more extra drops. But that's just me. So I'm going to add a few extra lavenders for myself. 1, 2, 3, 4, 5, 6, 7. Yes! Love it. Okay. And then usually what I like to do is just kind of smell it. See if you like it. Smells so lovely. And then you need to put a topper on it. This little device also has like a little center area where you can pop it back in and you'll hear a click, click. And once it's all the way in, you put the cap on it, write on your little sticker, label it, and you're good to go. You can use your oil on your wrist. You can use it inside your mouth. That's about it. You guys, again, happy Nurses Week. Much love to you all. If you need me for any aromatherapy rollers, find me. Bye.